We're selling urology. I'm going into the urologist's office for the first time. The doctor's name is Dr. Smith. Lynn's helping me out, and here we go. I'm walking in the door, walking up to the desk.
Hi, how can I help you?
Hey, my name's Harrison. I'm the new area manager around here in Baytown. I work with Inhabit Home Health, and I was just wondering if Dr. Smith utilizes home health.
Oh, not a lot.
Does he happen to do the TURPS procedure or UroLift?
He does the TURP. He's not doing the UroLift yet.
Has he ever utilized home health for a TURPS procedure, or does he like having that hands-on in his clinic with that catheter?
He doesn't use home health a lot. I'm not exactly sure why he doesn't, but I know, I have heard the MA say he doesn't like signing for anything other than Uro. He doesn't like getting stuck with blood pressure and stuff like that.
Okay. Do you know if he's available right now, or the MA, or are they back in clinic? What's going on?
They're both back in clinic right now.
Okay. Do you mind if I just have 2 minutes of your time right now?
Sure. There's no one behind you. Go ahead.
I just wanted to let you know that we deal with a lot of TURP patients. They go home. We can change the catheter in the home. We can also offer a voiding trial. I know that your MA would probably be more versed in this language. I'm not saying you don't know all this, but I know that she'd be able to just be on top of this. But also I wanted to show you this zone tool that we use with patients once they go home. So the education of the catheter, I know they're in here and y'all are telling them everything. So it's just a lot of information for them. So if they get home and they're maybe feeling like there's some pain or itching going on, or they can't actually urinate, we have this zone tool of green, yellow, and red. If they get into the yellow and they can look at their symptoms, they can figure out what's going on. Or if they get any of these red symptoms, they can automatically call our nurse on call, or they call y'all's office just to relay everything that's going on with them. Have you ever seen anything like this before?
No.
You think Dr. Smith would be interested in?
I can't see why not. It looks like it would be good.
And since he doesn't utilize home health, and I know you're not speaking for Dr. Smith, I'd have to have a conversation with him, and I only asked for 2 minutes of your time. Do you think that we could look in the last 2 weeks of any patients that had the TURPS procedure and maybe pick out one that you think could have some help at home? Maybe they're in a rural area, or they call up here a lot, because I really know that a lot of these patients do a lot of phone calls to the clinics because they don't know what's going on. They have pain. They're worried that they can't urinate. So do you think we could look at that calendar of the last 2 weeks?
Well, that's true now that you mention it. We do get a lot of those calls. I'd have to let them look at it, but I can give the MA and Dr. Smith a message for you. Can you leave those with me?
I cannot leave the zone tool with you. This is specifically for the patient. So when the first time we walk in their home, we leave this with them. We educate them on the procedure they just got done. I know they should know some of it, but then we'll explain this whole piece of paper to them, like what each zone